There's a story called The Story of the Buffalo and the Storm, about how buffalo behave in the midst of a big, huge storm. They put the most vulnerable, the older, the weaker, the young, in the center of their circle, and they put the stronger ones on the outside, and they move not away from the storm or try to go around the storm. They move right into the storm. You'll get through the storm faster, and you'll end up on the other side, and once you're on the other side, there will be abundance and peace and some rewards for that process. How would we respond to any crisis or any condition in our community if I was to respond in a way that this is something that my aunt, my uncle, my mom, my dad, my grandparents, my child needed? I'm Anthony Stately. I'm an enrolled member of the Oneida Nation of Wisconsin and a descendant of the Great Red Lake and White Earth Nations of Minnesota.
I'm an enrolled member of the Cheyenne River Sioux Nation and a current board member and founding member of the Native American Community Clinic.
I'm a family practice physician, so I'm a board member of the Native American Community Clinic as well at this point in time. I've been a board member for maybe 10 years.
There has never been a more greater need for our organization and the work that we do. We recognize that the way in which we do that type of work has to be more relational than it historically has been.
There is community in the name of NAC. It's a Native American Community Clinic, and as you can see, we had a lot of support from the community. We could not have built NAC without the support of the community.
And that's why we do so well, because our focus is on the community, getting people well, getting them over and behavioral issues or medical issues they have or dental issues. And it's done at a very professional level.
We work with American Indian Development Corporation and all of these other partners that we've built strong partnerships with in our community to bring health services to them, to our people where they're at, so that they don't have to have the experience of trying to find it like a needle in a haystack. Where do I go? What do I do?
A lot of my work is outside on the street, so I think that in itself is pretty unique for NAC.
My lived experiences with opiates and IV drug use, I understand, what people that we're working with during outreach are going through.
Doing this work and getting out there and trying to test as many people, but also returning and connecting them into care, I think it's so vital right now.
People are stigmatized against, and so, trust is imperative.
I'm Ojibwe, Dakota. I'm an enrolled member at White Earth Nation, and I grew up here in the city.
I'm from the Red Lake Indian Reservation here in northern Minnesota. Grew up there and really was inspired to take on some work where I could really make an impact in my community.
So right now we offer everything over telehealth, and we offer individual counseling, we offer play therapy, we offer group therapy, we offer behavioral health home services, and we are starting to offer integrated, which will be actually back in the clinic, which we're really excited about.
Somebody can really listen to you and hold that space for you. You find your own answers.
The mind-body medicine model is really rooted from within indigenous teachings of the medicine wheel, and really the importance of being balanced across your mind, your body, your spirit.
It kind of gives us a foundation, and I'm recognizing that there's a relationship with the medical model and our traditional model, so they can complement each other and support each other.
It's really focused on the long-term connection, the long-term care, like really empowering people to make decisions and informed decisions about their health.
We have access to traditional medicines throughout the clinic. That is something that we really prioritize.
We do a lot of smudge and talk about how that resets the central nervous system. And we also refer to our elders quite often.
I want to be the best relative that I can and make sure that the next 7 generations has these teachings available so that we're providing a path, a good path, be modesty win, for the next generation.
We really try and meet patients where they're at. We work with them in terms of where they are and where they want to go, and try and support them on their journey. It's been a real privilege to work with people and to have them share like really important and intimate things with me and the team. And it's really been really wonderful to see so many people achieve their goals of sobriety or to get further along the path than they were before.
NAC is also a spiritual home, a resource center, a COVID vaccine and testing center. Whatever it takes to improve the health and well-being of our communities, NAC steps into those gaps.
Every single person I talk to has been impacted by COVID-19 or by the coronavirus pandemic in some way, shape, or form.
We offer telehealth now, and we're able to then Zoom with patients for visits when appropriate, or we can Zoom with the patient, and then if a patient needs to come in, then they can come in and have much less exposure.
Access to these resources and access to care is the biggest barrier we're facing right now.
The pandemic has laid bare the inequities in our health system and other systems that directly impact our health and well-being. When I look at some of the structural level things and some of the data, it suggests that what we don't have is we don't have a lot of places or spaces where Native people trust to go and even get tested. We have a wonderful opportunity to reset our North Star and work towards collectively achieving better health for the Native community in South Minneapolis, our relatives in our community, our relatives in philanthropy, our relatives at state leadership and in governance recognize that they have a role to play in the expansion and the recreation of our health center. When you help me build something that improves the well-being of the Native community in South Minneapolis, all of Minneapolis and all of Hennepin County and all of the state of Minnesota benefits from that. NAC's vision is to create a modernized, expanded health center where they can take care of the emotional, physical, spiritual, and psychological well-being of the individual, the whole person.